Yeah, we have to mention this one. Yeah. Good afternoon, Dr. Chai.
Okay, hello everybody. Welcome to our advertisement proposal. And our company just have a fantastic proposal for this upcoming vitamin D milk. And the first thing we want to mention in our advertisement is what is vitamin D? And then vitamin D is a fat soluble vitamin, and it is naturally present in a few food, added to others, or available as a dietary supplement. And usually we can access the vitamin D from the sunlight. And when the vitamin D is in our body, it goes through two hydroxylations. The first one is in the liver, and the second one is in our kidney. And then people may ask why we need vitamin D, and this is because there are some deficiencies in nowadays, and there are some three reasons it may cause deficiencies. The first one is limited exposure to sunlight. You know, people now just sitting in the office or studying in front of the desk. So there's some limited exposure to sunlight. And people may have some trouble that their liver cannot convert 25-hydroxyl vitamin D into the active form. And then the last reason is they may do not have enough vitamin D in the diet, or they cannot absorb enough vitamin D from the food. And then this deficiency may cause serious consequence. The first one is the loss of bone density. And in child, it may cause rickets, which is a rare disease cause the bone soften and weakened. The second one is osteomalacia in the adult. And then it may also cause like diabetes, cancer, and high blood pressure. We don't want our family members to get into this, right?
Moreover, there's an upper limit for the vitamin D, which is also called the UL of vitamin D. And for adult and children above 9, it is 4,000 IUs per day, which is also 100 micrograms per day. And the vitamin D regulates two important bone minerals, which is calcium and phosphorus. Vitamin D also participates in several other functions, including cell differentiation, stimulation of the immune system, blood pressure regulation, and insulin secretion. And in our product of vitamin D, you can find 100 IUs, which is 2.5 micrograms. There's 100 IUs, which is 2.5 micrograms of vitamin D per 8 ounce of vitamin D milk. Thanks for watching.
People will benefit from vitamin D, so should I take some vitamin D supplement? In fact, large dose of vitamin D supplement may cause weakness, frequent urination, vomiting, no appetite, and lose weight. According to the U.S. National Library of Medicine, the DRI value for adults between 19 and 70 years old is 600 IU, which is 15 microgram a day. For adults over 70 years old, the DRI value is 800 IU, 20 microgram a day. For pregnancy and breastfeeding women, it's 600 IU and 15 microgram a day.
Instead of taking vitamin D supplements, many foods can also meet the RDA requirements. If you like fish, salmon and trout would be a good choice for you. For example, 3-ounce cooked salmon and also 3-ounce farmed cooked trout. Those can perfectly fulfill your daily vitamin D needs. 3-ounce swordfish have like 566 IU of vitamin D, and the total raisin bran contains 120 IU of vitamin D. If you like mushrooms, like this, 1 cup of white slide roll mushrooms can also be a choice, but the top food for vitamin D is milk, like this. I would highly recommend taking 5 cups of 2% milk fat milk with vitamin D fortified every day if you can. That would be really good.
So actually having too much calcium in your blood is not good to your body. If your vitamin D intake amount exceeds 60,000 IU per day and lasted for a couple of months, then it can be very toxic to your body because high amount of calcium in your blood causes hypercalcemia, which can damage calcium deposits in the tissues of kidneys, lungs, blood vessels, and heart. And it can also weaken your bones and create kidney stones and interfere with how your brain and heart works. And it can also affect your nervous system, which can result in tiredness, fatigue, or it can cause severe depression. So if you are experiencing any of those symptoms, or if you think that you are taking too much vitamin D supplements, then you should go see and talk to your doctors. And some of the suggested treatments are stop your daily vitamin D supplement intake, restrict your dietary calcium intake, or maybe take corticosteroids or bisphosphonates as your treatment.
Thanks for watching.